Do you think you might have a yeast infection? Or are you just curious to find out more about this topic? Anyway, watch until the end so that you can learn 8 facts about yeast infections. We have also included a bonus fact. So let's get started. What is a yeast infection? It is a fungal irritation affecting the vagina and vulva, causing discomfort, discharge, and intense itchiness. It's also known as vaginal candidiasis and impacts up to 75% of women at some point in their lives. Yeast thrives in warm or humid conditions, and people who have diabetes or are pregnant are more likely to get this infection due to yeast feeding off sugar or due to hormonal imbalances around that area. Fact number 1. Not a sexually transmitted infection. Contrary to common belief, a yeast infection isn't considered a sexually transmitted infection. However, the introduction of foreign substances plus the friction and irritation from unprotected intercourse can contribute to the disruption of the natural microorganisms of the vagina, therefore increasing your risks of getting infections. Not to mention that birth control methods that increase estrogen levels can also contribute to yeast overgrowth. Fact number 2. Medications. It is very unlikely for yeast infections to go away on its own, and it only tends to get worse if it is left untreated. This is why it is important to consult with a healthcare professional if you suspect you might have a yeast infection. Fact number 3. Recognizing symptoms. Yeast infection symptoms vary from mild to moderate and include itching, burning during intercourse and urination, redness, swelling, pain, and a distinct vaginal discharge. It is also important to note that the discharge has a cottage cheese-like appearance with no strong smell. Fact number 4. Causes of yeast infections. Candida albicans, a fungus, is the culprit behind most yeast infections. This is an opportunistic kind of fungus that can even survive outside the human body. Scary, right? Anyways, fact number 5. Who's at risk? Biological females are more prone to getting a yeast infection, mainly when they hit puberty or menopause. However, it is important to highlight that individuals with penises can also develop yeast-related issues, typically referred to as penile yeast infections or balanitis. Fact number 6. Prevention. Lifestyle changes can help prevent yeast infections. Avoid flushing water or other fluids directly into the vagina. Likewise, avoid spraying perfume or deodorant onto the vagina, and always opt for cotton underwear. Also, maintain a good hygiene, change out of wet clothes promptly, and keep blood sugar levels in check for those with diabetes. Fact number 7. Yeast infection and vulvodynia. Yeast infections could raise the likelihood of experiencing vulvodynia, a condition marked by persistent pain or discomfort in the vulvar region. Studies indicate a possible connection between recurring yeast infections and the onset of vulvodynia, highlighting the interrelated nature of specific women's health concerns. Fact number 8. Certain medications can cause a condom to break. That's right. Some medications prescribed for yeast infections may contain oils, which can potentially lead to condom breakage. This is why people undergoing treatment should abstain from sexual activity and avoid inserting anything into the vagina until the treatment is complete. Bonus fact. Do you remember how we said that pregnant women are more likely to develop a yeast infection due to hormonal imbalances and other factors? Well, some people might also not be aware that some medications for yeast infections, such as oral fluconazole, may cause birth defects. So always talk to your doctor before treating a yeast infection yourself. In summary, yeast infections don't tend to clear up without treatment and can result from various factors, leading to different signs and symptoms. Seeking assistance from a healthcare provider is key to preventing symptoms from worsening. Don't delay seeing a doctor if you suspect you have one. Getting timely help can make all the difference. Thank you for watching. If you liked this video, do not forget to subscribe so that you can have access to other similar content, and feel free to put a video recommendation in the comments. Take care. See you next time.